Hello everyone, I'm Dr. Shabahat. I'm consultant cardiologist nowadays working as assistant professor of cardiology. So today I'll be discussing another important topic with you guys. I hope you will like this as well. What we will be discussing today is like causes of shortness of breath. This is a very important video, I must say, and kindly watch it till end, and you will, I hope at end you will be able to understand it, like what could be the possibilities of your shortness of breath. First of all, I would like to request you guys that kindly like my video, kindly subscribe my channel, kindly click on bell icon because you can find various videos regarding various health related issues, and I'll try to make these videos in simple language because my purpose of making these videos are to make you guys understand regarding your health problems in simple language. Today this video is very important because this is one of the main concern of many patients, how they present to us in OPDs or in ERs, that they are having shortness of breath. I'll discuss bits of all briefly, and it will give you a very good overview. I hope so. Okay. So let's start. What could be the main reasons or what could be the causes of shortness of breath? Okay, so first of all, a very important thing that one of the reason is asthma. If you are having any asthmatic problem before or you don't know, one of the reason for shortness of breath could be asthma, or if you are having any problem like any pollen allergy or any kind of allergy, so it can also can lead to your shortness of breath. Another important thing or possibility, especially in smokers, is COPD, chronic obstructive pulmonary disease. In Pakistan, it's a bit ignored, but abroad, they properly follow that disease, and sometimes they prescribe for, they advise to have home oxygen as well. So, if you are a chronic smoker, especially if you have smoked for around cigarettes, I'm talking about cigarette smoking, especially. So, if you are a chronic smoker for around like several years, so one of the reason of your shortness of breath is COPD. Okay. So another very important cause which is related to my field, cardiology, that your shortness of breath could be due to your heart. So again, in that we divide it into various categories. It can be due to any irregularity of your heartbeat, like due to any tachycardia, any bradycardia, means like any increase in your heart rate, any decrease in your heart rate. Can be due to any acute myocardial infarction. Another reason, if you are already if you already had myocardial infarction in previous years, so if you are having heart failure symptoms or problems, so one of the reason for your shortness of breath and main reason in cardio is your heart failure. Again, in that, if your heart size is a bit enlarged, so that could be the possibility of your shortness of breath. In heart, like if you are having any kind of valvular pathology, like any stenosis or regurgitation, that could be the possibility of your shortness of breath. And another reason for shortness of breath is and especially if you suddenly develop with that, if you suddenly within hours or minutes sudden shortness of breath and difficulty to get air, and especially if it is associated with increase in your heart rate, which is tachycardia, Moreover, like if you are having any chest pain, squeezing feeling, or any chest heaviness, so reason for that could be pulmonary embolism. Like clot could have been traveled from anywhere into your pulmonary artery. So this is again a very important thing. If you are having sudden development of shortness of breath with chest pain and tachycardia, so pulmonary embolism can be a very good reason for your shortness of breath. Another important thing for shortness of breath is like if you are having low hemoglobin in your CBC, basic, which we usually advise to have CBC in some patient if they are paler in their looks. So your shortness of breath could be due to that, because in if you are having low hemoglobin, you don't have much RBCs, and basically RBCs transfer oxygen to your body. If you are having low hemoglobin, it will be a causative factor in your shortness of breath. And most important and most common causative factor in low hemoglobin in that scenario would be due to iron deficiency. Okay, so we need to correct it timely, because then directly or indirectly it will start putting pressure on your heart as well. So sometimes with markedly low hemoglobin, many patients can have myocardial infarction, because if their supply to their heart would be in a compromising situation. So that could be the possibility of having MI in that scenario as well. I hope you guys will like this video, because it is a very good brief overview, and I hope it will help you to understand what could be the main important reasons for your shortness of breath. I hope so. You will like it. Okay, take care. Bye bye.